All right, good afternoon and welcome everyone. My name is Meg Beyer. I am part of the Managed Care Technical Assistance team, and I'm excited to be delivering this BHCC Clinical Integration Learning Collaborative webinar today. This is our first webinar of the fall, and we are excited to get started. So with that, I'm going to just run through some logistics for today. So before we begin, as we've done with past webinars, we are going to record this webinar. The link along with the slides will be shared following the webinar. We are going to have participation that we will be hoping happens throughout the webinar. We're going to be unmuting participants to share your feedback, and we just ask that in order to be able to capture all the feedback, when you speak up, that you identify yourself and on behalf of which BHCC you're speaking. Just kind of gives us a better way of tracking who participates and which BHCC is participating. Additionally, we just wanted to remind folks that we will be having additional webinars coming up this fall. We have webinars that will be scheduled shortly and announced to this group and distributed via an announcement on November 15th and December 13th. As you may already know, we will not be having an October webinar, and that's because we have an in-person event happening on October 29th in Albany for the BHCCs. So I know that has been announced and opened, and that some folks have started to register. We're thrilled. We're looking forward to that event, and we just want to encourage you, if you haven't already, to do so, to register for the event. So with that, I'm also just going to remind you, if at any point you have any questions or you have maybe an idea for a future topic, we would encourage you to email mictac.info@nyu.edu. I know many folks are familiar with this email address already, but if you're not, please feel free to send us any questions or potential future topic ideas to this email. And also, if you are encountering issues with logging into webinars or receiving the announcements, please let us know. We do our best to make sure these systems function efficiently and well, and it really is helpful when you let us know if you're not getting announcements or information. So thank you to those who have reached out to us to say, hey, I'm not getting this information. Can you make sure that my email account is working and it's on your list? We appreciate that. So with that, I am going to pass along the presenter status to Erica, who's going to walk us through some of the content today. So Erica, please take it away.
Thank you. Good afternoon, everyone. This is Erica Vanderwall Ward. I'm the Medical Informatics Project Director on the PSYCHES team, and I am going to be talking about giving a PSYCHES update today and a live demo. So I'm just going to share my screen here. So here's the agenda. So I first wanted to just give everyone some updates on the PSYCHES BHCC Access View. And then we're going to do a live demo of the first BHCC Access View that is ready. It's the IDUHA IPA, and I want to thank the group from IDUHA for letting us use them as an example today for a live de-identified demo, just to show you what we've built so far. And then the really, I think, main purpose for conversation today is the drafted BHCC consent form. So we distributed that to all the BHCCs recently for any feedback that you might have. And so I wanted to open up, we'll do that in a bit after the demo, open it up for comment. And I had a couple of questions for the group regarding the form and implementation of the form. So that's the agenda for today. So just to start, some status updates on the PSYCHES BHCC Access View. So far, we have completed the development on the IDUHA IPA, PSYCHES BHCC Access View, and we have 3 more in progress, AHN, CBC, and Value Network. These are the groups that have completed the initial process with us of signing the service agreements for the development. We've invoiced for the work, and they've sent us their network in the Excel spreadsheet, so really told us who are their network providers. So after we get that information and those documents are signed and we get your provider network, it takes anywhere from 1 to 2 months for us to develop that BHCC access view for you once we have that paperwork completed and we have your Excel spreadsheet with all of the information we need on those providers. So that's just a little update in terms of current status and the timeline it takes to build these when it's a new request. So let me know if you have any other questions. Contact us on our help desk, and it'll be routed directly to me and Jeremy to talk with you about any questions that you might have if you're interested in getting a Psyches BHCC access view. So I'm going to show you a live demo soon, but basically we wanted to get out the first version of this as soon as possible, so there's still some additional features that are not yet in. So when we look at the I Do Have view, keep in mind that there's some new features that will be added to that view coming soon. So that's what another part of this update is, features coming soon. So as soon as we finalize the BHCC consent form and that starts to get implemented, we're going to be adding that BHCC consent form as a new consent option to our provider level users, so that when a provider in your network is consenting a client to the whole BHCC and the providers within that BHCC, they can indicate in Psyches that that client signed that BHCC consent form. And when one of your provider users indicates in Psyches that they got the BHCC consent form signed, it will allow that data to flow through into your specialized BHCC access view so that you can see all available data, including data with special protections like substance use information for that client, because they signed the BHCC consent form and one of your providers passed that through to you, technically speaking. So that's a feature that will be coming soon, and we'll add that in after this consent form is approved. The other feature that we talked about here on this meeting as a group was showing 3 different totals in the QI report. So right now you're just going to be seeing one total as this first phase of it, but another thing that we'll be adding in is the 3 totals. So that was the idea that some people wanted to show providers, the QI report totals for providers who were part of your network either before the BHCC initiative or had like a certain stake, like we're certain board members, or there's different differentiations on the provider types. So we'll break those out into 3 different tiers, the total, a tier 1, so to speak, a tier 2. So you can look at the aggregate provider information in our QI reports in those 3 different ways. So that's another feature that will be coming soon. If there's any questions on this update, maybe type those into the Q&A and we will definitely address any questions about these updates at the end. So next, I wanted to give an update about a reduced cost for the Psyches BHCC access view. So the cost for the development, and we've heard from some of the BHCCs about cost, and we didn't want this to be any type of kind of discouragement for BHCCs to be able to use Psyches. So the original estimate of the cost to build these views for you was based on the time it takes and the resources it takes for our team to develop these views, but we've reduced that a bit just so that we're not discouraging anyone from being able to get this. So it's reduced, the cost for initial development is 1.5% of your BHCC award with a cap at $35,000 to build the view for you, and then an annual maintenance, which the first development, the cost for development includes that first year of annual maintenance. After that, an annual maintenance was reduced to 0.2% of the award with a cap at $5,000 annually. And we have waived the fee to change the providers in your network. So if you have a provider that joined your network, we were originally planning to charge to make that change, just because of the time it takes for our team to implement that change and test that change. We're actually waiving that fee because we don't want to in any way disincentivize anyone from making updates to their provider network. So that has that the charge will not be incurred for changing your provider network. So I think some of the smaller BHCCs might see more of a reduction in their cost to build this view, but everyone really benefits, I think, from this waiving of the fee. Okay, so now to the more fun part, the live demo. So let me switch gears to our website, psyches.com, and I'm going to log in as if I was an IDUHA user. Live demos are always fun. We usually do our webinars with screenshots and PowerPoint slides, but I like to do the live demo whenever we get a chance. So what we do when we log into Psyches on a demo is select the de-identified data option, which is always available for any user up at the top. So if you are doing a demo or a training and you want to make sure you can demonstrate all the functionality but not show any client-level identifying information like name, date of birth, Medicaid ID, you use this de-identify feature at the top. You toggle that on, and now any client lists or any client-level data we look at will be de-identified. So this is the MyQI report of the IDUHA IPA. It's the first BHCC access view that has been developed. And again, thank you to IDUHA for letting us show your view for today's meeting. The MyQI report, as we've looked at this before in planning this, I've shown you some screenshots of what this would look like. The MyQI report shows a table of all of our quality indicator sets in Psyches and the prevalence rates for these indicator sets and in a BHCC access view, this is showing clients that were served by any of the providers in your network in the past 9 months. So they were served by any of the providers in your network in the past 9 months and currently meet criteria for any of the flags within these sets. And we roll up all of our quality indicators or quality measures into sets, and you can drill down into any one of these sets by selecting that indicator set name. So for example, if we were looking at high utilization, you select high utilization, that opens up an indicator tab, and you can see sub-indicators within that set. So if you really wanted to narrow down your focus to a specific kind of high hospital utilization, like I just want to focus on 2 or more ER visits, clients who have had 2 or more ER visits in the past year for behavioral health cause, medical cause, or mental health cause, you really can narrow down that focus. Or you can look at the summary measure, which looks at folks who had 2 or more inpatient stays or 2 or more ER visits for any cause in the past 12 months. So the first thing you'll see as a BHCC user when you select one of these indicators or the summary is a provider tab. These are the providers that you've told us are in your network. And we roll everything up using tax ID. So if they have multiple programs within their provider agency, we connect all those programs together using tax ID in the Medicaid billing, so we can know this is anyone served by any program within that agency in the past 9 months, and how many of those folks currently meet criteria for the flag that you selected, and then the prevalence rate. So the numerator over the denominator gives you a prevalence rate. You can always filter this report by a specific program type, like if you're interested in clients served by these agencies' clinics or their ACT teams or inpatient units and so on. You can filter by clicking on the filter button here. Under program type, you can filter these reports by a specific program type, by a specific managed care plan. You can even filter by a specific PPS, age group, etc. So you can put on certain filters to look at this information. So this is where you, as the BHCC, might be able to identify areas of like identify providers that have opportunities for improvement. So you want to look to see, okay, who has maybe a higher prevalence rate on this indicator, and I want to work with them and help them maybe find some improvement in this particular measure, depending on what your goals are with this data as a BHCC. So what you can do from here is, one other thing to point out here. So what we've learned in working with you is that some BHCCs or IPAs, you have data sharing agreements in place with many of these provider agencies, but not all of them. So you've shared with us in your spreadsheet which providers you have a data sharing agreement in place with, and we'll use that information for this next step here. So we're showing you the aggregate data for all of your provider agencies in your network, but once you click on one of these provider agencies, that's when the data sharing agreement status, yes or no, comes into play. Because if you don't have a data sharing agreement in place, we're not going to show you any client level data. We're not going to show you who these people are. So if you didn't have a data sharing agreement in place with this agency, you wouldn't know who these 148 people were. But you could certainly encourage that provider agency like ACQC to go in and look at that information themselves. I'm just going to pick provider agency from this list. And again, I've de-identified, so we're not going to see any client level details. But if you select that provider, now you're at that provider's QI screen. And this is what they could see if they get Psyche's access. So just as a general reminder for everyone, you would never give Psyche's access through your own BHCC, for your providers. All of your provider agencies, they can get their own Psyche's access by contacting us. Many of them probably already have Psyche's access or might already be using Psyche, so they can get Psyche's access in their own way through us. The BHCC view is just for your BHCC or IPA central office staff to get that Psyche's access. But here's where you can take a look at this particular agency and maybe identify certain programs in the site tab, identify certain programs that might have an opportunity for improvement on this particular quality indicator. Or you can look and see if they are a care management agency or a health home within your network. What is the breakdown of clients who meet criteria for this flag? And so, like, for example, Gay Man's Health Crisis, this agency has a care management program. And that care management program actually serves clients in 3 different health homes. So if you're interested in the breakdown of where this care management agency's program, where those clients are assigned to which health homes, that might be useful to you to know, like, of these clients flagged, and in this care management program, most of them are part of the Community Care Management Partners health home, if that's useful to you. Another way to look at this data is by managed care plan to see, so of the people served by this agency and meet criteria for this flag, how many are enrolled in each of the managed care plans? And this table will give you a breakdown of that to see, well, most of these clients are enrolled in Health First. So that might be useful to you, or that might be useful to this agency to know. And you can also just get a list of who these clients are, and this is all de-identified, but the Recipients tab is just a straight list of who these clients are that were served by this provider in the past 9 months and meet criteria for this QI flag. So that is my QI report. You can also go down to their clinical summary by clicking on their name. So you're able to do this because of your data sharing agreement in place. This is not going to include any substance use information. So going down into their clinical summary, you're allowed to see a certain amount of information because this provider serves them and they have a data sharing agreement in place with you as their BHCC, and they meet criteria for the quality flag. So in order to address that quality flag, providers can see a certain amount of information to help address that quality flag or that quality concern. But data that has special protections, like substance use information, for example, is scrubbed out. That's not available here. That's going to be the next feature of this view when the providers are getting consent for that BHCC, the whole BHCC consent form that we'll talk about in a moment. The providers will have to get that signed, and then enter it into Psyches, and then that will pass through that enhanced level of protected health information. So that's my QI report. Another area that I should show you is statewide reports. Statewide reports is where any Psyches user can go to look at aggregate information on these QI flags. So if you were interested in, you have to first select an indicator. I'm just going to pick high utilization again, or why don't I just show you some more measures that we have. So in the QAR, Quality Assurance Reporting Requirements indicator set, we have some indicators related to low medication adherence, no diabetes screening, things like that. So if you're looking at any of the QAR measures, you can submit that. And now you're really looking at a statewide view, and you can kind of cut this in different ways. You can put on some filters, or you could leave the filters set to all. And what I wanted to show you was the network tab. So the network tab is where we're going to be adding in all of the BHCCs. If we develop a view for you, we'll be adding you in so you can kind of compare against other BHCCs too on this measure. So if you want to see like, okay, on my DUHA, and as we start to add more BHCCs in this tab, you can see how I'm looking on this measure, or clients served by my providers on the measure that you selected compared to other BHCCs perhaps. This is where you could also look at managed care plans in the state on this measure. This is where we have a PPS tab. You can look at how all the different PPSs are looking on this particular measure, and that's statewide reports. There's also a provider tab. Lastly, I wanted to show you Recipient Search. Recipient Search is where you can go to conduct flexible searches to identify a population of interest. So if you wanted to say, out of all the clients served by providers in my BHCC network, how many people have schizophrenia, or how many people are have an active AOT order, or how many people have picked up an antipsychotic medication, or how many people have had 20 or more inpatient visits in the past year. So there's a lot of different things you can do with Recipient Search. And I am planning, of course, to do a dedicated BHCC training for once we get a few more people with this BHCC view all set up and ready to go, we'll do another training, and we'll do a series of trainings for you to dig in here a little bit more to show you how to use this. But this is just to kind of give you a quick flavor for what's available with this BHCC Access view. So I wanted to ask if anyone had any questions before we move on to the consent form discussion. Brad, would you mind opening up the line? So we're just going to unmute everybody just to give you a chance to ask any questions about the demo.
Okay, so we're going to have to take folks off of mute because someone has put themselves on hold. So Brad, if you could mute the attendees again, that would be great. Sorry about that, Erica. It seems like someone has put us on hold, so we had a little musical interlude. So I guess before Sarah gets started up again, I will send a message to all attendees and just say if you are not at your computer, if you could not put the phone on hold, just so we don't hear the music and we're able to hear folks if they have comments or questions.
So do you want to just have folks can type in a question in the Q&A box?
That would be great.
Okay. All right, so if you have any questions, we can definitely just do some Q&A at the end. Just type in your questions using the Q&A box in the WebEx menu. And I'm going to jump back to my slides. I mean, there are other features that we'll get into when we do the training, like utilization reports. We can go into more detail on the clinical summary, but we'll cover all of that in the more detailed training when we do the BHCC Psyches training. So let me now share my slides again. And I wanted to talk about the BHCC consent form and hear people's feedback on that. Oh, we did have a question about the demo just come in, about the PPS review. What can we compare? So I was just showing in Psyches, really anywhere where you're looking at reports, whether it be QI reports, statewide reports, even in Recipient Search, you can filter these reports by a district PPS. So that's what I was showing. And I was also showing in statewide reports, if you are drilling into a particular quality indicator, you can look at the district PPS tabs to kind of just see the PPS's head-to-head, what their prevalence rates are on the quality indicator that you selected. So it's a couple of different ways to look at the QI data when it comes to the PPS. So hopefully that answered your question. Annabella. Okay, great. So we sent out this draft BHCC consent form. We drafted this because we heard it would be helpful for BHCCs to have one consent form to use. So the goal of this form was to cover or get a client's permission to share client-level data between a provider in a BHCC network, between a provider and the BHCC, and between provider and BHCC to provider, to kind of cover each permutation of data sharing. So provider to provider to BHCC, and BHCC to provider. And because you're getting the client's permission to do all that in this form, it would include even data that has special protections, right? So the substance use information, family planning, genetic testing, even safety plans in our psyches consent form. We had one BHCC request including social determinants of health on this form, so such as like housing information, food, clothing, things like that, and any assessment results or care plans, like I said, safety plans that might be entered into psyches. Another thing that we're trying to cover on this form, but we still need permission, so I wanted to make sure I highlighted that in this, and this is just page 1 of the form. We wanted to include information about RIOs, or the qualified entities, but we're still working on making sure we get the blessings from RIO leadership before we finalize this form to make sure it is okay to cover RIO data sharing for the BHCCs and your providers through this consent form. So we're going to be working with the RIO leadership on getting that permission. So just wanted to put that out there. So this is just a glance at page 1. Page 2 is here just so we can jump to this if anyone has any questions. But it basically outlines coverage of data for psyches, RIO if we get that permission, EMR data, social determinants of health, really any information for staff to help getting the client's permission for staff involved in their care and involved in the BHCC to really help with their care planning. So page 2 kind of just is some FAQs for the client, because when a provider gets a client to sign this form, they want to offer a copy of the consent form to the client so that they know who to contact. So basically in a lot of these blanks are for the BHCC name, and the other, so here's the other important thing to note about this form, which we described in the email, is there's a place for you the BHCC, to put your website on this form. And the great idea that we got from our lawyers, from Mark and Denise, is from OASAS and from OMH, was if you list out all of the providers in your network on your website, and that's easy to find, you can put your website on this form rather than having a separate page that lists out all your providers, and that might change if you have a provider join or a provider leave, that your website, your public website, would reflect who are your participating providers, and then you just reference that website on the form. We do a similar thing with our psyches data, because sometimes we're adding in new sources for psyches. We list out all of our data sources on our website, and on the consent form, on our psyches consent form, and on this consent form, we say what our psyches website is, so a client can always go to our website to see what types of data is there. Also on this form, it tells the client what to do if they want to take back their consent. What if I decide I don't want my data to be shared? Then this tells them who they can call. So what I would recommend here is you filling in who you want them to call if they decide to withdraw their consent. Is it you, the BHCC, or is it one of their providers? It also gives them information if they have any concerns that their data was used inappropriately, or someone was looking at it they didn't think was supposed to. There's they can call the BHCC. So this is where you would fill in your BHCC entity name and a phone number who they should call if they have any concerns, or they could, if they really wanted to bring it up the chain, they could call the state's attorney or they could call the Office of Mental Health Customer Relations. So I have some comments and also questions about this form for the group, but I also wanted to open up the line to see if anyone had any questions for me that I could take back, or any questions, since we're lucky enough to have Mark Boss from OASAS Counsel's Office on the line, if people had specific questions about the form. Should we try to open up the lines again to see if maybe that person has come back, Brett?
I think we should. I did message all the attendees to, if just kindly, if you are going to step away, to not put the phone on hold. So let's take them off mute and see if it works. And if not, we will ask folks to. Oh, darn. Okay.
Oh, darn.
Oh, darn. All right. So let's mute the phones. And then, folks, if you could just chat in your questions, we'll monitor them as they come in, and I can help read them out loud. Unless you could chat them right to Erica, and she could see them as well.
Sure. Is there a way to see, Brad, whose line that is? So if we unmuted everyone and then just muted that person, is that possible or no?
Erica, I actually looked into it, and I don't think we can. I'm sorry.
No, that's okay. That's all right.
Yeah. So, folks, if you'd like to chat in your questions, that would be great. And then we could proceed that way.
I'll just wait a moment to see what questions, and we'll just start with your questions before we get into my questions. See if I'm getting anything.
So, Erica, I'm not sure if you've gotten some questions, but on my end, I haven't seen any come in.
We just had a comment from someone saying they didn't get an email about not putting the call on hold.
Oh, it was chatted through the WebEx box. It wasn't an email. Mm-hmm.
So so while we're waiting for people to put in questions, I'll go through some of my questions. The first was just a comment, which I actually already mentioned when I was showing the form, is that we did include real language on the drafted consent form, but approval for this is still in progress. So we'll keep everybody posted about that, and I hope that we can include it on the final version, but we have to, of course, make sure we have the right approvals to do that, so that's in progress. This next question that I have is really, the reason why I'm asking this next question is because of the way we're going to technically build this out in Psyches. So what we're planning to do, and I mentioned this at the beginning, but I'll just go through what we're planning to build and how we're planning to work this in Psyches is after a client, so a client's being seen by one of your providers, right? And that provider would get the client, ask the client to sign this new BHCC consent form. And the client, let's say the client signs that form, and then a staff member from that provider logs into Psyches and attests that consent was obtained. And that's what a lot of these providers are already used to doing. Many of your providers have been using Psyches for a long time. They use the Psyches consent form. They have a workflow for that. Many providers integrate that consent form into other forms the client's already signing, like HIPAA, consent for treatment during their intake, perhaps, and they just sign that Psyches consent form. Perhaps they will be replacing this BHCC, replacing their Psyches consent form with a BHCC consent form because it covers more. So you have to go in and attest a user from that provider agency has to go in and attest that consent was obtained. And what we're doing in Psyches for our provider users is adding a second checkbox where they can attest that the BHCC consent form specifically was signed. But what they're going to need to do in order to pass those privileges on to the appropriate BHCC Psyches user is tell us in Psyches which BHCC consent form was signed. Was it IDUHA? Was it AHN? Was it CBC? They have to tell us which BHCC form the client signed, right? So that we know which BHCC to pass this data to. So my question is, would a single client in that moment ever be asked to sign two different BHCC consent forms by the same provider? So my understanding is that a provider agency, if a provider agency has multiple sites that are located in two different counties, then a provider technically could be a provider in two different BHCCs. But would a client ever need to sign two different BHCC consent forms with that one provider? And the reason why I'm asking that is because if this might be the case, and even if it's rare, even if it only happens once in a while, we might have to build it so that the Psyches user at your provider agency can attest in that moment when they're indicating in Psyches that the client signed the BHCC consent form, that they might have to select more than one BHCC, okay? They signed a form for IDUHA and they signed a form for AHN, let's say, because my agency as a whole is working with both of these BHCCs and I want both of these BHCCs to see this client's data potentially. Would that ever happen? What do folks think? So if you could respond in the chat, if you have any thoughts of it, that would never happen, that's not necessary, or this is a possibility, we might need a client. If you could just kind of let me know, that would be helpful. If you're not sure, it would be really helpful if people could let us know afterwards through Psyches Help or through MCTAC to just kind of tell us your thoughts on that question, because it really is the difference when we're technically building this, if we're going to allow you to select one BHCC or select multiple. See if I'm getting any responses in yet. So I see that, Carol, you're sending questions in the chat, but we're not seeing them. I don't see them. Are you sending them to all participants, Carol? Whether you're using the chat or the Q&A box, if you can send it to either all participants or all panelists to make sure we see your questions, because I'm not seeing them. Okay, so Carol said, I definitely think there will be examples of a client served by an agency that is in one or more BHCC. And another person, Michelle, said, I definitely think there will be, Michelle said, I could see patients ending up in multiple BHCCs. Lisa said, I do think this could happen. Our organization has some withdrawal and stabilization in several counties. They may return to services in a different BHCC. Okay, that's really helpful. So three different people said this might happen. So I think that answers my question, that we're going to have, when we build it, we'll make it so you have the ability to attest that this client signed more than one BHCC consent form. Okay. I also see we got a question from Carol. We heard that the BHCC had to have their legal status as an IPA to move forward with this. Is that accurate? Not that I know of. I mean, to be able to get the Psyches access view, as far as I'm concerned, you don't have to be an IPA. I think in order to, when the BHCC initiative ends, I mean, that's maybe the open question, what will happen to your network and what will happen to your psyches view when the BHCC initiative ends. If you're no longer, if you're going to then be an IPA, become an IPA, you kind of change into this real legal entity, your consent form would change at that point. But you don't have to be an IPA in order to get this Psyches BHCC access view. Did anyone else on the line from our panelists want to comment on that question? We heard that the BHCC had to have their legal status as an IPA to move forward with this. Individual network members, our individual network members would not have access to a dashboard that allows them to see their performance compared to other agencies in our network. Well, actually, so your individual providers, they can get Psyches access through us, and they might already have it. They'll be able to go to statewide reports and take a look. And they can even drill down into your BHCC view as a provider. What they won't be able to do is access client-level data for another provider. Does that make sense, Carol? And I'm going to go back into, let me see if I have to log back in. And I'll show you what a provider can do once your view is built. So let's say I'm one of the providers within IDUHA. I'm a provider agency within a BHCC network, and I want to take a look at myself compared to other providers within the BHCC network. I think that might be what you're asking. I log in with my own provider access. Let's say I'm Canva. Canva logs into Psyches with their own token, and what they would do is come to statewide reports, select an indicator. Let's say they're interested in looking at high utilization, or really you can select anything just to drill down into that network page for IDUHA. Hit submit. That loads a map of New York State and the proportion of clients served in each county who meet criteria for this flag, and it loads a series of tabs beneath that map, such as a tab called Network. So even though I'm Canva, I can still come here because this is all aggregate data. I can even click on IDUHA. So I can click on IDUHA and go to IDUHA's QI screen because this has been built. And now I can take a look at myself, my prevalence rate, compared to everybody else in this network. So I think that's the question you're asking, Carol. Can I Canva, provider within this network, look at myself? And you can. But if I'm Canva and I try to go into Bailey House and see who these clients are, Psyches won't let you do that. You're going to get a message that says you don't have permission to look at this client level data. You can just look at the aggregate data. Okay? Let's see what other questions we have. Can we see this data as a chart rather than a list of numbers? Chart. Oh, well, like this. So that's a good idea. We have this provider tab, but we don't have like bar charts for the providers. We just right now have bar charts for your BHCC as a whole for each of the indicators, and that's really just comparing. One bar is your network's prevalence rate, and one bar is the statewide prevalence rate. But that would be that's a good idea to add bar charts here in the provider tab. So we'll take that back to the group, to our programmers, to see if that will be something we can add to the list, perhaps as a future enhancement. If that would just be easier to look at that more visually. Bar charts would be ideal. Okay, cool. That's a great idea. I think that would look nice here. All right, let's see what else. Okay, so here's another question that came up, and we actually got a question from a PPS that a PPS is helping one of the BHCCs with their data, and they wanted to be a security manager for the BHCC view, and that got me thinking about how PPS, when PPS uses psyches with their own special type of psyches view, and they have special rules in place, like a PPS doesn't see any substance use data at all. So if they had access to a BHCC view, they could potentially be looking at information with client consent. But a PPS, technically, when we were originally drafting this form, we were thinking of just network providers, right? That this consent form was covering your network providers. So basically, the question's coming up, should affiliate providers, such as some of your hospital affiliates or your PPS affiliates and so on, should they be covered on this consent form too? So we asked Mark about that, and it was suggested that they could be, but two things would have to happen. We would have to really perhaps explain the difference between a network provider and affiliate provider on the consent form itself, and those affiliate providers would, of course, need to be listed on your BHCC website. So not only listing out who all your network providers are, but also who all your affiliate providers are. So I posed that question to the group. Is that something people want? Do you want affiliate providers to be covered by this consent form in addition to your network providers? So please chat in your answer.
And just as a reminder, I know there's been a little technological difficulty with the chat, but if you look at the chat box, you'll see there's a little arrow to the right-hand side, and if you select all panelists, then both Erica and I can see the questions as they come in, or your responses, actually.
I think one person said probably yes. I think that was to the affiliate providers question. Do you want affiliate? Does anyone else think it would be beneficial to have affiliate providers covered on the consent form? Is there any downside to that? Will that make any clients less likely to want to share their data with so many different providers? In addition to all the providers in your network, I'm also agreeing that you're going to share it with all these other providers too. Are there any downsides to that? Or do we want to go for it and add them in there too? Is it a sharing back of data or just gathering data from? So one person asked, the option to have both would be helpful. Is it a sharing back of data or just a gathering data from? The consent form is trying to cover both directions. So it's not, the goal was also to be in addition to psyches, like maybe EMR data too. So providers sharing with other providers within the network, providers sharing with BHCC, and a BHCC sharing with providers. So we're trying to make this form cover all directions and get the client's permission for their data to be shared in all these different directions. So thank you, Carol. Clinical integration is key, so it would seem that affiliate providers would need to be included. Okay. So I think maybe I'll move on to my last question, and maybe if anybody sees any problems with including it, just let us know either by contacting McTac, or you can of course contact us on our psyches address. If there's any reasons to not include them on the form. Otherwise, I can work on editing the form to include affiliate providers, and just everyone would have to kind of include in our instructions to all the BHCCs that all providers, including affiliate providers, would need to be listed on the website. Okay, my last kind of thing to bring up is implementation of this BHCC consent form. So as I mentioned earlier, a lot of the providers in your network are already using Psyches and have had clients sign the Psyches consent form already. So if they're BHCC, if you want providers to indicate in Psyches, like get this form signed and then essentially share that client's full Psyches report with you, technically through the Psyches, these providers are going to have clients reconsented, right? So I think, probably for most of you, I might be stating the obvious, but I wanted to make sure everyone kind of noticed that this is not only reconsenting clients, but this is a change to existing workflows, perhaps, in a way, or it's changing the form. So it's telling your providers, okay, we're going to ask you to replace your Psyches consent form, or at least include the BHCC consent form as well. I mean, some clients might say, I don't want to share all my data with all those other providers. I just want to share my data with you, my provider. So in that sense, they are still using just the Psyches consent form, so just their provider staff can look at this client's data if that's the client's preference. But for clients that are willing to share their data with the entire BHCC, that's adding in or replacing this new, with this new form. And then reattesting in Psyches that it was in fact the BHCC consent form that the client signed, and doing that for each client. Otherwise, you won't be able to view some of this data that some of the BHCCs have said they want to be able to see the substance use information or be able to see client-level data for clients that don't have a quality flag, which is the other benefit of this consent as far as Psyches is concerned. So have you BHCCs discussed plans to implement this consent form and how to communicate the implementation to your providers, and is there anything that you can learn from one another on like thoughts or ideas for implementing and messaging to your providers about use of this consent form? I don't know if, well, we're at 1 o'clock. I was going to say maybe we could unmute again, but we're at 1 o'clock. So that's maybe my last kind of food for thought that we can maybe bring up on a future call, or people could maybe think about and suggest over email. So if there's any recommendations or ideas people have for implementing this consent form effectively to your providers, or messaging about it, what you'd like people to do in replacing or adding in this form, particularly when it comes to Psyches, then please feel free to share, and we could always kind of include that in an email out to the BHCC group as a whole, kind of to share lessons learned or recommendations or suggestions. Those are all the questions I had, and my last slide is just our email address on the Psyches team if you have any questions, comments, or you need any support with your paperwork. If you're requesting this access view, you have any questions, comments, or need support, contact us on the Psyches help team at psyches-help@omh.ny.gov. Let me check to see if there's any other questions. Carol was asking if we're sending the slides, and I think, Meg, you mentioned at the beginning, are they distributed, the slides, or just posted to your website along with the recording?
So the slides and the recording will be distributed directly to everyone who joined. So you'll be getting an email from us, hopefully in the coming weeks with this information.
Great.
Yeah.
Thank you.
So I want to thank you, Erica, for leading us today through this webinar and all these really exciting updates. And thanks to everyone who chatted in your questions. Again, really apologize for the snafu. Next time, before our next webinar, I'm going to remind everyone that if you join, we ask that you not put yourself on hold during the call. And, you know, stay tuned. We'll be circulating the recording and the slides when we have them available. And as Erica said, if you have any questions, feel free to email the Psyches team directly. The email is listed right here on the screen. And if you have more general questions specific to the BHCC Clinical Integration Learning Collaborative, you can also feel free, thanks, Erica, to email mictac.info@nyu.edu. So thanks, everyone, and have a wonderful rest of your week. Take care.